guys, it's Abby from Total Health Center. If you got to this video, you scan the QR code on the back of your supplement schedule. And I'm gonna go over some things to do to try to help yourself before you jump in a panic on the phone because of some of the symptoms that you're having. On the back of your supplement schedule, you see some anti-pathogenic supplements, which are your killer supplements. These what kill the active bugs within your body. Then we have our drainage supplements, and then there also is a section called binders. So I'm going to quickly go over just some common questions that we get, a lot of phone calls of people and patients coming in and calling us about, hey, what does this symptom mean and what can I do to help relieve it? So the number one common symptom that we get is loose stools. So if you're on a parasitic protocol or even a Lyme's protocol, you may be on a supplement called bowel mover. And that does exactly what it says. It moves your bowels. Now this is super important when dealing with a parasitic infection. We want those dead parasites to come out of the body, and their main elimination pathway is through the bowels. Now, if you're having a very urgent need to go to the bathroom to have a bowel movement, that is very typical in a parasitic protocol. We need to get them out. But if you're going to the bathroom and it's very, very loose, if you need to stay close to home, if you can't go out, that might be a little bit of a problem. So I'm going to tell you what to do in cases like that. If you're on a bowel mover, you have to look at your dosage. Let's say you are on 3 bowel mover per day, and you're having really urgent, really loose stools, and it's interfering with your day-to-day life. What I'm gonna tell you to do is you're going to decrease your bowel mover by 1, see how you do for a day. If you're still having loose stools, you're gonna cut it back by even more. So you're gonna start with the 3, you're gonna take it back, so 1 and 1, go down to 2 a day, see how you do over 24 hours. If you don't notice any change, you're gonna scale it back even more. You're just gonna take 1 bowel mover per day. Now, you wanna make sure you're still going to the bathroom on an anti-parasitic or even a Lyme's protocol, because that's your main elimination pathway of dealing with those things. That's loose stools, so that's a major symptom that we get through the office. I get calls on that all the time. The other thing that you wanna do is with loose stools is to make sure you're following your diet as well. Lots of good protein, lots of good meat. Just depending on what diet you're on, you want to make sure you're following the right protocol on that. Another common symptom that we get phone calls on is something called a Herxheimer reaction. Very achy, very joint pain. We get fever, feverish, feeling chillish. You might get some headaches or night sweats. That's very common with kill-off of Lyme's. Some people can also get it with a parasitic protocol as well, but we typically find that in our Lyme's patients. We want to increase our drainage if we have any symptoms of that. So look at your drainage supplements. You'll see a list on the back. If you look at your dosage, so let's say you are taking 4 total KL support per day. If you're having any of those types of symptoms, you're going to increase that by 1. So instead of taking 2 KL at breakfast and 2 at dinner, you're going to increase it by 1. So you're going to do 3 KL at breakfast, and you can also increase it by 1 at dinner. So 3 and 3. See how you do over the next couple of days. That should kind of subside your symptoms. If your symptoms are still persistent and they're still there, that's when you should give us a call and make sure that we might have to scale back on the anti-pathogenic supplements, but normally increasing the drainage should take care of that symptom as well. Those are kind of the common questions that we get in phone calls. So again, if you are having persistent symptoms, even without trying these things, give us a call. Otherwise, try these things before contacting us.